The post-surgical ammetropia with precision laser correction. I'm Dr. Pushpinder Kaur from Eye Hospital, Jalandhar. So there are many situations in ophthalmic surgery where the patient is not happy with the outcome of surgical procedure because of some refractive error left behind, and we still can handle such a situation by counseling the patient for a second refractive procedure, thus converting the unhappy patient to happy patient. In my practice, I come across the following situations where the patient can be given wow factor of surgery by carefully manipulating and customizing the right procedure for that particular patient. In such situations, the unhappy patient can be made happy by selecting second procedure of the surgery, thereby eliminating the residual error which was left behind by the first procedure. Here, these are called bioptic procedures come into rescue. So what is bioptic? It's a combination of vision correcting refractive surgical technique in which two refractive procedures are used to treat the eyes. Second procedure, which is a constant, is usually corneal refractive surgery. The situations which are warranting the second procedure are residual refractive errors after LASIK or epiLASIK after cataract extraction and IOL implant, pseudophakia with spherical IOL, pseudophakia with toric IOL, residual refractive error after trauma, repair, post-RD surgery, post-regium surgery, post-ICL. After C3R, after stabilization of corneal ICL can be done to correct refractive error. After squint surgery, amblyopia can be partly corrected. After PKP, refractive procedure can be corrected. The second procedure is done only after the refraction and the incision of the first surgery has been stabilized for at least 6 months. So this is a case which we did here. The IOL is already in place. This was a 65-year-old man who had got IOL done elsewhere, and this was the previous phaco incision, and he had about 6 diopters of astigmatism. So we went ahead and did the second procedure, refractive surgery, which made him very happy. So this is a very old video when we used to do with microkeratome. This I did with the Amadeus. So we are hardly using it, we are not using it anymore. But anyway, just to show different procedures that we changed over the time. So this was Amadeus microkeratome, 140 microns. And I used to always mark the asymmetric marks on the cornea so that in case of any mishap, I know where exactly to place the flap. So flap back. So this is showing a femtosecond flap. This machine has also become obsolete now. Though this was a wonderful machine, I was very fond of this machine. So I still have it, but they say we will not give you the spare parts and we will not give you the maintenance. So we are forced to go into the next procedure. We bought the new Elita machine by Johnson & Johnson to make flaps and the silk procedure. But yes, this was a very good procedure. So this is the laser going on. Dr. Sahil will agree, this was a very nice machine, femtosecond. And while creating the flap in this, throughout the procedure, we could actually visualize everything in real time. So laser being done. Just cleaning the interface and putting the flap back. This is epileptic or lethate with alcohol. I really like this procedure. Wherever anything else is not possible, this is a wonderful procedure. We just remove the epithelium and do the laser and put a contact lens, and within about 5-6 days very nice epithelium glow goes back, and we put mitomycin in such cases to prevent haze, 0.02% mitomycin. This is in a scarred cornea. So this patient was working on a kharad or something, and he had multiple small holes all over his opacities all over his cornea. So I was scared that the laser would not cut through them. So hence I went for epileptic. Once we complete this, I will show you the magnified version, and you can see, I mean, in spite of getting so many marks, see, you can see small multiple marks. He never used any protective glasses. So the procedure is chosen according to the corneal curvature, corneal thickness, and the profession of the person. Before the second procedure, I'll just run through. So thus bioptics is a very important procedure which can be used in a planned way to correct refractive errors, and can also be used to bail you out in refractive surprises. There are many ways of making post-operative unhappy patients happy and customized refractive procedures. Thank you. This is Mount Tetlis in Switzerland. So very beautiful place. Thank you. Did you take the picture? Forgot. Thank you. Anything? Any questions? Thank you.
Thank you, ma'am.